That's your job. You're the dentist.
Yeah.
Same with the Invisalign course. The Invisalign course isn't there to teach you orthodontics. How can you condense a 3-year master postgraduate program into 1 or 2 days?
At the moment, do you own a practice, or are you working as an associate?
Corporate associate.
Corporate associate. Welcome, guys, to another episode. We've got Dr. Rohit Chaturvedi with us, and he is living the dream life. I mean, he's in Perth, Australia, for one. Everybody's trying to get to Australia, so he's definitely somewhere where we all want to be. He actually is qualified as a medical doctor. He's also a dentist, clinical advisor for Invisalign, a speaker for Align and Itero, and is an educator for Right Global, as well as Smile Fast. So he's doing it all. And we're going to be getting a lot of value today with his insights and what's going on in the world of aligners and Invisalign as well. So thank you, Rohit, for being on today with us.
Oh, it's my pleasure, Arnold.
So just give us a little bit of insight into what is life like for you at the moment in terms of family, work. What's a normal day to day for you?
So if we start in the week as normal, I'd say Monday is a work from home kind of day. So normally I'll be doing treatment planning and content creation, writing lectures and things. And then Tuesday, Wednesday, Thursday are my clinical days. But I'm also will be on a Monday and Tuesday will after hours teach the diploma for what was Aligner Consulting, what is now Aligner Dental Academy. So I'm the mentor for anyone in the APAC region, the Asia Pacific region, and Australia, New Zealand. So if anyone from there is doing that diploma program from the City of London Dental School, then I will be their mentor for here, and we'll run the those sessions, the catch-up sessions here. So I think you did that program as well, that diploma program. And so Andy was my mentor. So I was really keen to bring that across to this part of the world because that gave me so much and set me on my trajectory. So I was super keen. So that's what I do here. As I said, Tuesday, Wednesday, Thursday is my my clinical days in practice, where I'm a lead dentist at the practice where I work and a clinical advisor for the national corporate where I work. Yeah. And then Friday again is another admin day, work from home day, where I fail to get my invoices done. And I find working from home is really hard. You're at work and you're so efficient, seeing patients back to back, getting things done, and then I try and work at home, and it just doesn't quite add up. It's not quite the same. I'm not as efficient, but that's what I do. And then Saturday, Sunday, I try. I'm making more of a mindful effort to be present at home in the weekends, because I think the problem is when you do all these roles, you almost let it take over, and you're so, especially with the online stuff, you're so accessible. And things like Invisalign, you could be doing clean checks all weekend, and then before you know it, you're losing that family time and that key moment. So I would say to you, how my daughter's getting older and things, and she's like, no, she's in year 7, and I'm thinking, well, it's not the equivalent of year 8 in the UK, and I'm already thinking like, wow, how many years have I got with her at home? And I want to spend more time. So I'm becoming more and more mindful of the weekend becoming more about family time.
That is, I feel like 4 different people could be kept busy with what's involved in your life.
I need to follow those online PAs to help me out, I think.
So, I mean, I want to take it back even further to just find out, how do you get from studying medicine to where you are now, teaching on clear aligners and Invisalign diplomas? How did that happen from medical doctor to this?
I think I came out, I saw a lot of transition happening. So I did medicine from 2001 to 2006 as studying at Nottingham University. And in that time, I saw a lot of change. And as a junior doctor, I saw a lot of things going wrong. The European Working Time Directive, the gradual privatization of accommodation that meant junior doctors wouldn't get free accommodation their first year, to lots of transition change to our contracts. And I remember at the time going to the I was the junior doctor representative for the doctor's mess in the hospital where I worked. I remember going to the British Medical Association stakeholders meetings, and I was just livid with where the career was going and the control and the monopolization and what was happening in medical careers. Seeing how the large amounts of bullying that went and the bullying culture within the NHS. I loved training. I was training as a urologist, and I loved my job, but I couldn't work in that system anymore, and it just came to a head. I knew it was always going that direction. I think at the time I had lots of friends who just thought I was overreacting and things. It's really funny now, having left the UK and seeing all the junior doctor strikes and everything. Like, this is what I was complaining about in the early 2000s, early to mid 2000s. This is what this was always coming, and but I got that point where I just couldn't stand it anymore. I said to my wife, "Look, I want to go. I can't do this anymore. So we either jump country, or I change career." And my wife said, "I don't want to go because she had elderly grandparents and family, and she was in the middle of her GP training. She was on a very good scheme in Southeast London, so she didn't want to go." I said, "Look, no." I said, "Look, I changed career. We go." And she's like, "Okay." I was like, "Cool. Let's pack the bags." And she was like, "No. You're changing career, mate." I was like, "Call my bluff." No, so I changed, and it was funny because I did a lot of I did what many medics do. I applied to management consultancy companies and big pharma, and there were some offers there on the table, and some interviews lined up. And when I was doing my ENT jobs, I became really good friends with quite a few dentists who were doing max fax rotations. And we become really close, and I'm still in touch with a lot of them. Some of them are my best friends, and they turned around to me and said, "Look, what do you enjoy?" And I told them, "Look, I really enjoy day surgery. This is what I like in my day." And I'm like, "Why don't you do dentistry?"
Yeah.
And I mean, I've got a bone to pick with them because I think they will set me up for a fall, because I didn't realize the NHS and dentistry is pretty hectic. But I did it. I applied to King's College London, and they have that 3-year program for graduates. I thought, look, going to university is going to be awesome. I'll be back in uni. It'll be good times. I can work at locum. This will be fantastic. I didn't realize that dentistry is way more serious than med school, because unlike med school, there's not that expectation to be there all the time. In dentistry, there's that, there's an element of professionalism that you need, which is it's what's expected of you is at a higher level than med school. Because number one, you've got to be treating patients. Two, so you've got to be turn up, you've got to do that, you've got your quotas then, because you have to get stuff done before you graduate. And the quotas in the UK are pretty high in pretty much every institution. We do a lot of stuff when you consider the world, what goes on in the world. We do a lot of amazing stuff in dental school. I think we've got some of the best dental education in the world in the UK. But then at the same time, if you're not doing your things, you have to nurse for your partner, your clinical partner. So you don't get time off. So I didn't realize how intense it would be. The opportunities to work meant I had to work at night.
Yeah.
Because my wife was pregnant my first year of dental school. So it meant we were paying like rent. So I was actually commuting. So my wife wanted to move close to home. So we moved to her home, her family home in Birmingham. And I commuted to London every day for 3 years. And I would do night shifts to, pay the mortgage and the rent. We did have a lot of good support from my wife's family, which was great. But then when I came out, I was doing my first year in VT, and my wife was just broken by that system, that the NHS, the GP system, and said, like, "Look, do you want to still go to Australia?" And I was like, and in 3 months we were gone. Which was
what appealed about Australia and not America or somewhere else? Why Australia?
Well, to be honest, English speaking. I didn't want to learn another language, and then I didn't have to sit in the exams. And I know that sounds awful, but the idea, I think, of having done medicine, then my membership exams to Royal College of Surgeons, then done dentistry, and my membership again to Royal College of Surgeons for the faculty of dentistry. I just felt I felt like a non-stop cycle of exams over many years. And the idea then having to do like, I don't know what the equivalent. I think to go to America, you have to do the last 2 years of dental school. I think it was something like that. When I looked at it, actually, no lie. I had a friend in my graduating year who was seriously thinking about practicing in the US, and he looked at the system and he explained at the time it was something like you basically have to go back as an international student, do the last 2 years all over again. And I just thought, no, I couldn't bring myself to go back through that process.
Yeah.
Whereas Australia was a very relatively easy transition to do. There was nothing extra. It was just plug and play. Just get a job, find a visa sponsor, and get going. And that's what made it easy.
Yeah.
Path of least resistance, they call
it. And I see, messages on groups where people are still asking about how to do that transition to working as a dentist in Australia. Would you still say there's an appeal working in Australia today in the current climate in Australia? Do you still think it's an appealing prospect?
I think it's a fantastic place to work. I don't want to sound disparaging about life in the UK and the NHS, but I would struggle to go back, especially practicing how I practice now.
Yeah.
Don't get me wrong. I think there are people in private practice in the UK who practice probably very similar to how I practice here. But I think if you're in the NHS system, I think you've been trained to such a high standard in UK institutions, and then you can sometimes lose your mojo when you go into the NHS, and it's hard. And it's like I think the game is rigged to make you fail.
Yeah.
It's a hard game to play, and I think you've got to decide what's right for you. Some people will love that, and kudos to them, power to them. But it's not a game I want to play, or I could play.
Yeah.
And I felt personally there were ethical questions of how do you practice appropriately. I know obviously there are people who find their way, and there'll be people who argue the other way, and that's fair enough. But I think the idea that for me in Australia, you could practice the way you want to practice. You can practice what you were taught. You can take your time.
Yeah.
I think funny enough, I think things seem to have got a lot better since COVID. Because I think there's been a lot more private dentistry that's come about, which has given a lot of dentists freedom. And I think the urge for people to leave the country isn't as significant as it was. The urgency isn't there like it used to be, because more people can get more mix. But it's funny when I look at those doctors for doctors groups on Facebook, or general comments in random dental groups from the UK. There is still a lot of negativity around the NHS, and I don't.
Yeah.
I understand why. There are a lot of problems. I mean, I still remember the last year I was practicing in the UK as a dentist, and I remember, was it the what's it called, the General Dental Council put that advert in the papers, calling out for the general public to sue their dentist. And it was like, how does our regulator get away with this? And I think things like that were just, I think it was a final straw for a lot of people. And I was really keen to get going.
Yeah. And how did you find that transition when you did move to Australia?
Well, it's one of those weird ones where I remember speaking to the guy who owned the corporate practice for it, which signed me up.
Yeah.
And he was showing what my books would look like, and he was telling me. So his name was David Bailey, and his wife was Susie Bailey, and she was a manager of this group of practice called DB Dental, and we've been since bought out by national corporates. But I remember him saying to me, like, well, it's half an hour for a checkup for a regular patient, 45 minutes for a new, and it was. When he showed me, I was like, what do you do for 45 minutes on a new checkup? I was like, I was so used to 15-minute checkups, I had no idea, and so that perplexed me. I remember seeing dentists when I came here and saying, like, what do you do for 45 minutes? Like, you talk to the patient, you get to know them and think. And now I struggle to do 45 minutes. I feel like I need an hour. And there are times where I overrun. I need an hour to do everything I want to do. And I'll talk to them and catch up. And my regulars, I book long ones to catch up with them. And how's your nan doing? Like, how's your sister? Oh, how was your wedding or your mate's wedding that you went to or whatever? Like, how's that holiday? It's nice to be able to spend that time and give those patients that added value.
I
So
agree
that,
with you. You
yeah,
start to look at things more comprehensively and holistically.
yeah,
Same thing that happened to me when I transitioned fully to private, where it was
yeah,
45 minutes. It's 45 minutes for new patient exams, and it's still not, definitely still not enough time. Probably might have to bring them back
100%.
to talk about treatment options and what they're actually going to go for. So,
So true. And the thing was, I remember because where I was, because I was a first year, I think I was in a really tricky zone because even though I was an experienced dentist, I was an experienced clinician, having practiced medicine for, I think, at that point when I graduated, I'd been practicing medicine for 7 years,
yeah,
and 7 or 8 years at the time. So I was an experienced clinician, but I was at the bottom of the ladder in dentistry. I'd just come out. No private place was ever going to hire me to do private dentistry.
yeah,
And so I think that for me, it was like, I just couldn't wait to get out of the NHS system. So I was like, I want to spend time. I wanted to do the best I could do. And that
yeah,
route was leaving.
yeah.
And that's why I think that worked for me. But like, I remember my boss, her husband owned a private practice
Hmm.
in the West Midlands. And the same reason, or the reasons why he went into private practice. He would tell me about his practice. And it's very similar to what I'm doing here.
Yeah,
I don't think it's very different to what UK private practice is like. But I suppose the only thing is, like, I understand that people get burnt by the litigious nature, I would say,
yeah, yeah,
of UK dentistry, and I can see
yeah,
why that would scare people, and, like, why that kind of may push them to up sticks and things as well,
yeah.
because we don't have a very litigious culture within Australia. It's really not. It's actually. I'll tell you what. I remember I came and I saw a patient for a checkup, and I mean, I work in a quite affluent area at the moment,
Yeah.
which in the UK is always working quite impoverished areas, I would say. And so coming working in an affluent area was really strange. But then I locumed a couple of times to cover other practices in areas that weren't so affluent. And I remember seeing a patient had a lot of caries everywhere. And these would often be heart sinks for me, like in the UK, because I'd be like, oh, they're going to blame me for everything. I've had my checkups every 6 months. Why have I got decay? Why have I got all these problems? And the guy just said to me, oh, well, it's my own fault. I shouldn't have had so many lollies. I was like, and they were all taking responsibility.
Wow.
I just couldn't believe it that people were owning their problems.
Yeah.
And the culture difference was so intense. Like, I couldn't believe it. I was waiting for them to have a go at me and blame me for their problems, and which is what I was used to, being attacked effectively. But that
Yeah.
wasn't happening. So that was a culture shock for me.
Man, what would you say? Would you say there was a difference in how your communication skills had to be when you were a medic and then when you were a dentist? Or would you say that it's the same challenges communication wise, the same level of communication or type of communication you need to have with your patients? Is there a difference?
I think the sad thing is in dentistry, no one teaches you communication. The
Mm,
reality is, like, it's a medicine we're taught, like, really well how to communicate. Well, where I was in Nottingham, it was we would have these go into these rooms, be recorded. We'd have live, consultations with an actor. The crowd, we'd have everyone in our group watching it happen. It'd be recorded. We'd break it down. We'd say, like, and the person leading the session wasn't a clinician. It would
mm,
often be another actor or a non-medic leading the session, and it was very much about. It wasn't about getting the knowledge to get the answer. It was about how do you communicate to get the right answer. That was amazing. I didn't really probably appreciate it as a student at the time.
yeah,
And then going to dental school, you got none of it because with so little time in dental school, it's all focused on actual practical skill.
yeah,
There's no time in the curriculum to learn um, communication, and we
yeah,
don't focus on the soft skills.
yeah,
And often we need to go
yeah.
out and get it.
No,
But it's
that's
very
interesting
similar.
to hear.
Yeah,
Uh,
yeah, I do. But I see what you're saying though. I think it's very similar. It's often it would sound like breaking bad news to a patient. I know, like, it sounds ridiculous comparing, say, breaking bad news about having a cancer or something to telling someone they've got decay, but it's the same range of emotions and things that they go through. The kind of the shock, disappointment, cost implications, what's going to happen, how it affects their smile, losing their teeth, losing their function.
mhm.
They go through the same processes, so it's not too dissimilar.
I want to sorry, I took a bit of a diversion there. I want to
That's all
carry
right.
on your journey then. Okay, you've moved to Australia, to Perth. You've started working, you've got much more time with patients. Patients are taking ownership of their dental health. Um, how do you then progress towards aligners? What made you take that step?
I think my problem was like I was just a checkup and clean dentist, I'd say.
Hmm.
And so I'm working in corporate practice. You feel like you're a bee in the hive, and you're just doing checkups and cleans. The odd bit of quadrant dentistry here and there. The odd crown, maybe bridge or whatever.
Yeah.
Nothing serious. I never did full mouth rehabs. I still don't do full mouth rehabs. Um, and and then I just kind of thought like, well, when people come with their smile problems, there's often like a simple solution to fix it. And sometimes people don't want to see someone else; they want to see you. They're like, if you can do it, I'll do it. But if you can't, I won't. I'll leave it alone. And I always remember my VT trainer saying to me, she said to me like, right, once you feel comfortable in your day-to-day dentistry, the first thing you need to do is do an orthodontic course. Have some form of short orthodontics up your sleeve and all you do is cherry pick the low-hanging fruit. She's like, just take the simple cases like the ortho relapses. Someone wants veneers and you just want to like correct the position so you don't drill them down too much, and you can use like really minimal prep and stuff. And those words were an echo in my head. I was like, you know what? I've been a dentist for 3 or 4 years at this point. I need to do something about this. I think I've been a dentist for about 3 years. I thought I really need to do something. I need to do something differently. And so I just did the Invisalign course. It just seemed the way that things were going. No one wanted to fix brackets and wires. I didn't want to have that complication in my practice. Then you have to have all the equipment that comes with wires and brackets. I think there are a lot more things that can go wrong, a lot more emergencies. I didn't really want that. And that's why I thought Invisalign was going to be the best option for me. There are no emergencies, at the end of the day. It's pretty much you bond them up and you're kind of done. A lot of software to help you plan.
Yeah.
And again, all I wanted to do was just pick the low hanging fruit. And that was it. That was all I was going for.
And how did your development with the Invisalign system go? I mean,
Rubbish.
one
Was
of the
awful.
things that I hear people say is, the training is insufficient, doesn't prepare you for treating patients with aligners.
I
And
love the course.
I hear statistics where people might say that a lot of dentists are providers, but they never actually carry out a case.
Yeah.
So yeah, what do you say to that in terms of aligner training
Well,
is
I was
insufficient?
kind of say to people like, if let's say with endo,
Yeah,
if you buy a pro taper, you don't have to do a course or anything. You get pro taper, you get going, or wave one. And if you do want to learn about it, then the rep comes in and shows you. But do they tell you how to find MB2? They don't. You don't expect them to find MB2 for you. That's your job. You're the dentist.
yeah,
Same with the Invisalign course. The Invisalign course isn't there to teach you orthodontics.
yeah.
How can you condense a 3-year like master postgraduate program into 1 or 2 days? Like
Yeah,
it's lunacy. All the Invisalign course is there to show you is how to use the Align platform of the system.
yeah,
So they're saying we've got a product. Here's how you use the product. That's it. That's their responsibility. It's the dentist's responsibility to learn orthodontics, to understand their scope of practice. No one else's. And
yeah,
so this idea that they're there to teach you that stuff is ridiculous because even every midline course the world over, what's the first thing they tell everyone? Don't do anything complicated. Just take some mild relapse, class 1 cases to start with. Keep it simple. Don't do crazy class 2s. Don't do crazy class 3s. Just stay nice and simple. Start to understand orthodontics, see how it works, and then slowly build up. Supplement it with courses and things. But that's not what happens. Everyone kind of thinks that that they expect to learn orthodontics in a 1 or 2 day course, which is weird because no one expects that from any other course, specialty, any
I wonder
specialty
where it's
course.
come from. I really do wonder where that
I
way of
wonder,
thinking has
yeah,
come from.
got no idea. But going back to what you said, when you say like, what was my journey like? The reason I say it wasn't great was because I went in. I was one of those people as well.
Yeah,
I'm not going to lie. I was warned as well before I went in. I spoke to an Invisalign provider who said to me like, "Look, if you think you're going to learn orthodontics at the end of this course, you are not coming." And I did the course, and I was like, I didn't feel prepared.
mm,
Um, because obviously there was a mismatch in what I believe and what the reality was.
Yeah.
And then the next couple of years, I think about between 2 to 3 cases a year.
Yeah.
That was it. And I just wasn't sure of what could I do, what I couldn't do, what was realistic, what was unrealistic. And that's why I knew, like, I need to learn something. And that's why I signed up for this diploma course, this, the one with Andy and Raman, what's now the Aligner Dental Academy,
Yeah.
postgraduate
What
diploma,
cohort would you have come under?
cohort 3.
Cohort 3. Okay, so I was cohort 8.
Oh,
So just keeping that in mind, first time I met you, you were actually coming to speak, as part of the line program that had been set up there, and that's where I got to see you share some of your journey, share some of your cases, and the crazy cases you were taking on.
yeah.
So I want to pose a question to you, which is, okay, do aligners produce inferior results to fixed orthodontics? And is that why people shouldn't really get into aligners, because they produce inferior results?
No, I don't think they produce inferior results. I think that it's another tool. It's another tool in the armamentarium of orthodontics.
Hmm.
It's really funny. I think you can see that there's a lot of bias in the literature that's out there at the moment, and there's always these camps of we're pro aligners and we're pro fixed, and I don't think that really exists. To be quite honest with you, I think it's just biomechanics. It's what do you want to achieve and how do you want to achieve it. They can all get there. I mean, in theory, the argument is fixed is better for a deep bite, but a clear aligner is better for an anterior open bite because of the way they favor each of their biomechanics. But it doesn't mean to say you can't treat an anterior open bite with a fixed appliance. And it doesn't mean to say you can't treat a deep bite with a clear aligner.
Yeah.
It's just knowing the correct biomechanics to do it. And I think that's what the problem is. Often a lot of the people pushing a lot of the literature out there at the moment. I mean, we spoke about this when we were in London and stuff as well. Is a lot of the guys putting the literature out there. If you look at their biases, a lot of these guys don't know much about clear aligners and clear aligner biomechanics, but they're putting out all these papers. And then you look at their studies and how they conducted them. So one of the things they always go, there was no overcorrection was allowed for. Well, how's that fair? You allow for overcorrection on a fixed appliance because you will create a massive bend in it and you'll keep tweaking it. But you won't allow for overcorrection within a clear aligner. That doesn't make any sense. And in the same way, you go like, oh, we didn't allow for additional aligners or anything else. But you're like, well, hold on a minute. You're constantly tweaking the case in fixed, but you won't allow for any fixing at the end in a clear line. So there are a lot of things that just don't make sense.
Yeah.
And so as a result, I would say I think that's the problem. People are looking at it the wrong way. There's many amazing orthodontists doing amazing work in clear aligners. Many who run in clinics that purely do clear aligners and no fixed. And so I think I wouldn't go far as saying everything can be done in a clear aligner. Just as I would say I wouldn't go as far as saying everything can be done fixed. I think there's just right biomechanics, right patient scenario, right case. And yes, you can do some crazy stuff in clear aligners, and it may take forever to do it, but you can do it.
Yeah.
And vice versa with fixed. So, but you've got to take into account what the patient wants as well. So I think that's and in reality as well, the whole concept that everyone should finish in class 1 and everything. I mean, I don't understand what that's about, to be honest with you. I mean, you don't say everyone, every lady out there is a size 8 or a size 10 or a size 6 or whatever, or a 12 or whatever. You don't say that every guy should be a 30-inch waist and a 40-odd chest or whatever that is. Like, you don't. Everyone's individually different. Everyone's biologically different. So this idea of one size fits all is just ludicrous.
Yeah.
So I think there are issues around the whole clear versus fixed camp. I don't believe in it, to be honest with you.
Yeah, I love everything you just said there. I was just trying to keep quiet, just so it could all come out in one go. Definitely use that for a reel or something. But I want to then move on to, okay, you teach dentists on the Invisalign system. What's stopping dentists from actually starting cases? or doing a lot more cases? You know, what is that stumbling block? What do you find?
I mean, I think a lot of it's knowledge. I think a lot of it comes down to knowledge, imposter syndrome. In some parts of the world, it'll be where general dentists are frowned upon for doing orthodontics. I think ortho is one of those specialities. I think in a lot of places around the world where it's still seen as like orthos for orthos only. We don't see as much. We don't see that much as much anywhere near as much in like pros, for example. Even oral surgery, we don't see it that much. Like, don't get me wrong, no general dentist is going to go out and start fixing a mandible, but we will see lots of general dentists who love doing whizzies, who are very good at whizzies. They may have done a year or two max fax, done whizzy, like loads of whizzies, and they feel super confident in surgicals. And then they like surgery so much they want to go, I want to do implants and things. And we see a lot of that, but we don't see backlash from it. But there's almost like if you're a general dentist, you can do a little bit of ortho, but in some places, but you better not overstep the mark as a general dentist. And certainly in some countries and states and territories and other areas, there is a whole like, well, we don't like general dentists doing any orthodontics, and there is a real ill feeling towards general dentists. I don't know why that is, but I think then dentists feel a bit scared to take on the cases. They're worried of what other people will think. And I know a lot of the questions I get in the courses are like, I don't want to. I'm really worried about what the ortho down the road is going to think of me. And ironically, I say, well, actually, Invisalign brought me closer to the orthodontist down the road. In fact, he's one of my besties now, because I remember when I took on Invisalign, we had an honest conversation. I said, look, I'm doing the Invisalign course. I said, but obviously I'm going to see patients for Invisalign consults, but I don't think I'll be able to do all of them. If I can't do them or I'm not feeling comfortable, can I turf them to you? And he was like, yeah, great. And he goes, and conversely, if you need any help or anything, or you're not sure, give me a call. And it was a very synergistic relationship, because guess what? He's getting a lot more patients who were keen on Invisalign, because I'll give them a good consult where I say, like, look, these are the risks and benefits, blah, 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 blah. These are the costs, but it's outside of my ability. I'm not sure how I'd do this. So if they're going to see him, they're going ahead 100%. So he's not getting any tie kickers. He's getting prime patients who are good to go. But also, I've got a safety net. If I go on and do a case, I've got him to back me up. And I found that helped me grow as well. And it really grew our relationship. And even now, like, I still have a great relationship. Even though I do many cases, I still like, if anyone I don't want to treat, I don't feel I can treat, I pass them on to them. Or if I feel like someone probably would be better in a fixed case, or I'll pass them on to him, because I don't want to do any fixed in practice. So
that's really good. That's really good, because only yesterday I was talking to an orthodontist. He was actually giving me some tips on a case that I had posted, and he was saying, "Why did you do that?" And he was just being open about how I could improve. I appreciated that. And after that conversation, I was actually replying and then saying, "Oh, I've just sent you a referral for a lady that I can't take on, which I think would be great if she saw you." So it actually drives you closer to the orthodontist, and you have a much more fruitful relationship. Whereas before, you probably never even met the orthodontist, orthodontist area.
I agree. I think that the thing is, like, I find that that should really bridge the gap. We should have these like meaningful relationships, because I know if I've got a problem with an ortho case, I can call. It's funny because my ortho down the road, he said to me, like, "Oh, look, right, if you're really struggling and they need like some fixing up, a short spell of fixed or whatever, well, they like just send them to me. I'll sort them out for you." I've never had to call on his help in 7 odd years for that kind of thing, but it's such a wonderful thing to have that. A phone a friend scenario, as it were, and we should have these relationships. That's, I find, the best thing about dentistry. We should have these open, comfortable relationships where we can signpost people to the right people to get the right treatment. And I think that's the great thing. And I think having these synergistic relationships really help. Like, just because you're a dentist who does implants doesn't mean you should take on every implant. Just because you can do something doesn't mean you should do something. Sometimes the case of knowing your limitations and then signposting to the right place.
I want to pick your brain then on, let's say, the ultimate roadmap to becoming like Rohit when it comes to using aligners. So let's say,
Make it like hard.
how many years have you been using aligners for now?
Since 2017. So what's that? 6
About 6
years?
years.
6, yeah.
All right. So if I was to ask, if you were to go back or to talk to yourself 6 years ago and map out how you get to this point where you know as much as you do now on clear aligners and your technique with it, your skills with it, how would you map that out so that you shorten that 6-year pathway and avoid unnecessary detours?
Okay, so the quickest thing is obviously do a course. Like so, obviously in an orthodontic course like Invisalign, Invisalign Go, whatever. I would do Invisalign Go. It's a great way. There's so many fail safes in there.
Mm,
From the minute you take the photo with your IPA, your Invisalign photo app, and you get an assessment in there. Is it easy or a complex case? It tells you very quickly, so is it me or do I turf it and handball it somewhere else? And so I think I would get on and do Go. I would target the low hanging fruit,
mm,
and I would scan everyone. That's the key. The key is to scan everyone. It's amazing how many times you do a checkup and you won't quite click, and the minute you see the scan, forget the patient. The minute you suddenly go, oh my god, there's ortho relapse, or there's mild crowding, or notice the calculus build up in the lower linguals. And I always quote Dr. David Galler, who one was I think, I'm not sure if he still is or not, but highest Invisalign provider in the US. He's based in Manhattan. And David Galler did a tour of Australia. I think he would have been around 2018 or 2019 or something. And I never got to go to it. I remember the Align employees and my local PDM, practice development manager, comes into practice and says, Rohit, this guy was amazing. He was fantastic. Dr. Galler says, and then I'll never forget this line, if you show the patient the scan, the plan writes itself. And it was this epiphany moment, like this magical moment. And then suddenly, things started to make sense. And when we got a scanner, that's what we did. We showed them all the scan. And the amount of times the patient said, what's that? What's going on here? And they were asking. So one of the things I always teach in all the courses that I do is how do you start the conversation? How do you not feel like a used car salesman trying to sell something to someone that they don't want, and then they get the defenses up? You know, sometimes they'll put that medical history form, I'm interested in straightening my teeth. And then you will ask them and go, when you see them first time, go, oh, so it says here you're interested in whitening or straightening your teeth. They go, no. I just want to check I'm clean. I just want to clean. That's it. Because they're scared you're going to sell to them. And that conversation they're worried about, or they're self-conscious, or the financial element involved. If you just show them the scan and they see it and they ask the question, you've just changed the conversation. You start offering them a solution to a problem that they brought forward.
yeah.
You're not trying to tell them something or make them do something that they weren't aware of, they don't want to do. They've seen a problem, they've identified it themselves, and they've asked you for a solution, and now you're telling solutions. I think that's really powerful. And that's where scanning really helps, because they see their ortho relapse straight away when they go, oh my God, my teeth have moved. What can I do? You've got 3 options. 1, do nothing. It'll just get worse. 2, accept it and retain it. 3, correct it and retain it. If you can't afford 3, but you want to do 3, go to 2 and just retain it for now, save up the money, and then do it. Or go on a payment plan or whatever. But then you can have an honest, ethical conversation with your patient. And I think that's the power. Communication is everything.
Yeah.
There'll be a time in the not too distant future, I think in the next couple of years, where no one's going to care about your chart.
Yeah.
They're going to want to scan. That'll be the way forward. That'll be the basic level of dental record, having a 3D scan of a patient. All you need is a perio pocketing chart or a CPITN score. The 3D scan will be everything.
Yeah, no, you're dropping gems there, and valuable information that you'll pay thousands of pounds for in some courses. And you're giving it for free. It's some good stuff. So just to recap, get certified, start out with something like Invisalign Go, take the low-hanging fruit, build that relationship with your local orthodontist, scan everybody.
Every patient, every new checkup.
Okay,
monitor
so
them.
what are we now doing from here to get to where you are with your level of experience
So
and technique?
what you'll find is you do those little steps, you'll find that you do a lot of ortho quickly, a lot of simple ortho quickly. You'll get I honestly believe, especially in the UK, I think with the number of patients that are there and everything, you can easily get to doing a case a week.
Mm.
Not doing complicated stuff, just doing simple everyday dentistry. We see enough stuff there every day that we can do this stuff. But you can do a lot of stuff. And then so once you want, if you decide, hey, you really love ortho, by all means, or you want to learn more, then start thinking about doing things like the diploma, and that will give you the tools to gain confidence in doing slightly more complex cases, more complicated cases, or even more important, I think, is how to red flag complex cases so you don't fall in the dangerous trap of doing things outside of your scope.
Yeah.
It's not about how to do, I want to take on this really ridiculous case. It's more about how do I identify problems before they become my problem and I have to own them because the patient's paid me.
Yeah.
So I think it's really that's the key. And then you'll do more, get that confidence to do more. And then, if you really love ortho, you can do full. But if you decide that, you want to become an align, bleach, and bond guy, just do some good composite courses. And again, the diploma course to work out how you can push and go to the limits. And you can start pushing go the limits, doing great restorative work. I mean, I think we've all seen Afan, in the UK. I think everyone in the UK must know Afan singing. And that guy does it I mean, I don't know. I think he's still just primarily a Go provider. But that
Yeah,
guy's
as far as
so
I know,
good.
yeah. Yeah.
Yeah, and for last time I knew, I saw him, he was just doing Go and doing a line bleach and bond, and he was just profitable, as a general dentist, line stuff. No, they want nice straight teeth. Well, look, we want to do minimally invasive, ethical dentistry. So we're not looking to overhaul your bite or anything. We're just going to get the teeth in the right place and then bond it up nicely, or veneers or whatever. And I think that that's what you want to do, it's quick, predictable, profitable, awesome. And I think that's how you get to where you are. You're where I'm pretty much where I think if you decide you'd like to do ortho, want to do more, you do that diploma,
Yeah.
and then you can push it further with mentoring and things. So I still see, even with my position, everything I've learned, I'm finishing my masters in clear aligners. I don't think you need to do that at all. If I'm being honest with you, I really don't think. I think if I had my time again, I wouldn't have done that.
Mm.
I would have just found a good mentor, done one-on-one sessions. So I try to do reflective sessions once every couple of months with an orthodontic mentor who's actually based in London, funny enough, and he's amazing. And we sit there and we might even talk about cases. I might or a case that I want to plan. We might just be often it's a case of I'm showing him case that I've done, and we're reflecting on why things didn't go right, or what I could have done better, or why I need those additional aligners. And that process of reflection and learning I find so beneficial. And you pick up stuff quickly because sometimes you just need another set of eyes. And you may already know it, but they'll just tune you in.
Yeah.
And so that kind of coaching and mentoring I really enjoy.
Yeah. That's
Then
really
also
good. That's really good because yeah, no, you're talking to where I am at the moment because I was actually looking into clear aligner masters, and I'm thinking about that next level. You have to give me the details for who you use for that mentorship, just to because I think it's for me anyway. That's that next progression. So it's interesting you say getting that practical skill of doing simple cases. Then if you want more, something like a diploma, and then the next stage can then become mentorship at the highest of levels that you can find out there.
Yeah. I think that's it. I think that's what it's like. Don't get me wrong. I'm sure that there'll be lots of other competitive programs out there. Master. I mean, I spend a lot of money doing courses, and often the time it's not necessarily because I feel I'm going to learn something.
Mm.
Obviously, I will, but sometimes you're just going for little gems. You're not going for
Yeah.
big lessons. And often I want to, because I still think aligners is still very much in infancy in terms of this. It's rapidly changing. Our knowledge of clear aligners and biomechanics and adjuncts and how we use them is changing so rapidly.
Yeah.
You need to be on top of it. So that's why I constantly find I'm attending like lots of courses, lots of great congresses happening at the moment. I think like the TPAO is a big one as well for me. I think like that how I think that's the big thing at the moment. How do you marry your technician and the clinician together? I think that how you marry that relationship, how do you communicate with them effectively? And I think that's Matthias Pepper and David Rakovich. And as I said, Dr. David Rakovich is like big mentor to me. I'm a big fan of his. Like if I'm in London, I will get in touch with him and try to meet up with him. Amazing clinician. But I think is that one thing they're doing at TPAO Congress is showing dentists and orthodontists how to communicate with the technician. How do we speak the same language? Because often that's what we want to do. How do we communicate with them exactly what we want? I think that's a big area at the moment.
Yeah. So, I mean, if we just change the conversation a little bit, I guess people might say that you're heavily involved with Invisalign and Align. But people may say, the lab bills are too high for Invisalign. It's just plastic at the end of the day. Why should I not be using any other aligner provider? I could potentially be getting just as good results for cheaper lab bills, and I can pay per set of aligners that I order. So how do you view that sort of challenge to say why should it be Invisalign?
So for me, I would say I think you got amazing value in Invisalign. I know it's really interesting that people talk about the cost, and I think the first thing I'll go to is you get a PDM. You get a PDM who comes to your practice and trains your team. So my PDM was in the practice 2 days ago, training all the staff in the practice.
When you say PDM, sorry,
practice development manager. So your Invisalign rep, or we call them PDMs here, practice development manager. And because they're not a sales, in my opinion, they're not a sales rep. They're here to develop your practice. So they come in, and you can book them in to come and train your team. Like I don't teach them anything, so they'll give them the access to my account, limitations or whatever. Show them all the things they can use, how they can educate patients. They'll train them. They'll set up my open days and things, everything. And they do the same the world over. So number one, where did you get that? Align education on the IDS, on the Invisalign Doctor site. You've got the whole education tab. You've got the global gallery to learn from. You've got constant webinars and learning as an Invisalign provider. There's all that stuff. Hey, that's not even taken to ClinCheck yet. ClinCheck, which is the most, powerful software in the world in terms of orthodontics, data's got from 15 million cases that have been mined. 15 million cases of data have been mined. There is no other orthodontic company in the world that has a data bank this big. So you've got the most predictable system there. You've also got the system in terms of 3D controls. Like how easy to do 3D controls, live updates, Smart Architect if you want to do ortho restorative. You don't have to go and pay for DSD. Oh wait, you pay for dental monitoring? You get virtual, virtual AI virtual care. Like what? Why? So many value on value on value on value, and but not to mention the most fundamental thing: smart track material, the most predictable plastic. When we talk about 7-day aligner changes, we're talking about smart track material, not any other material out there. And we can talk forever about the graphs and so on, but the thing is, for a clear line to work well, you want a gentle, constant force. So you predictably know where it ends at 7 days. If you have a really stiff plastic, which a lot of people try and market, well, the reality is that force starts off insanely high. But as we know, stiff plastic will deform over time. So what happens is it rapidly deforms and the force drops off within a day or two. And it's far below where the smart track material is. So where it ends up at the end of a week, 2 weeks, that's why you have to wear it for 2 weeks. Yeah. You don't quite know where it's going to end up. But we know with smart track, we can go and do it rapidly. So the studies, the quality of that plastic, it isn't just a plastic.
Yeah.
Smart track copolymer is a whole different material altogether. That I'll put it this way. Invisalign's profits on a year, their profit margin of a year, is the equivalent of every other aligner company's gross in a year. And Invisalign put more money into R&D than every other company combined. There is no one else who's doing what Align do, constantly innovating, constantly changing the game. Many companies, when you look at what they're doing, a lot of it comes down to, waiting for Align's IP to finish and then trying to copy it. And that's what it is. And then we hear people talk about like, oh, don't use, company specific attachments and things. It's a way of attacking, the optimized attachments and bits. But the reality is, as you heard, like when Roman was talking about Arnold in London, the data actually suggests there's no truth in that. Optimized attachments, when planned with the right smart staging and so forth, is working just as well as traditional attachments. So actually, I think Align's so far ahead of the game that actually you're getting extreme value. If you're buying another product with inferior packaging, inferior plastic, takes longer, less predictable, more additional aligners. Yeah. I mean, yes, you only pay for what you use, but you're going to use more of them. Everyone I know who's left Invisalign, who does it to a high level, most of them have gone back. And independent speakers who've gone and done it, they've gone like, actually, the truth is, we get our results better, quicker with Invisalign. Our communication with the technicians better with the Invisalign technicians. Yeah. Results come back quicker. The quality is more. And as I said, if you're paying for then DSD on top, dental monitoring, throwing in CBCT and all those things, like clinical team support. Who gives you clinical team support? I don't know anyone else who's doing this.
Yeah.
And so I think what you get from Align is incredible, and the constant innovation. I just don't think you can compare it to anyone else out in the market.
And I've never heard of a patient come in asking for something else.
Exactly. It's like like a Hoover in the UK. No one goes like, I want a vacuum cleaner. They go, I want a Hoover. Yeah. And it's like in America, everyone goes like, I want Xerox. Like, Xerox that. And let's photocopy it. They say Xerox. And Invisalign is synonymous. And here's the thing, like, it's a really weird thing. When someone goes to your practice, goes, I want Invisalign, and then you give them another brand of something, you look almost like you're cheaping out, and it's like a little crusty, broken box. And I know there's some of the competitors out there, and their product, every time I've ever spoken to, every time I've seen it, they've all said it just doesn't compare. If you ever use Invisalign and then use another product, you go, oh wow, it's not the same. Yeah. But there's some very interesting things happening online. I think what Align are going to come out with in the next couple of years is going to blow everyone's minds. I think like where AI is going and where they're taking us, there's a lot of magic to happen in the next couple of years, or even the next year, I'd say.
Yeah, so I've seen the difference in quality of product that Align produce or Invisalign produce compared to others is with the retainers, because I used to make locally lab-made Essex retainers, changed to Vivera.
Right.
And I've had some patients where maybe I've done a locally lab-made one, because 24-hour turnaround, and then I then get that same patient into Viveras when they arrive. It's night and day how much more comfortable and how they enjoy the Viveras compared to these locally lab-made Essex retainers.
I'm not gonna lie. What's really interesting is so I went through a phase of making. So I do a lot of 3D printing in house, and I'm really big. I love 3D printing. It's one of my favorite things, and even designing in Exocad now has become like a bit of a passion now.
Yeah.
But what's really interesting is I went through a phase of making all my patients in-house Essex retainers, scan them, print the model off on the day, suck down, bang, they got the retainers. I'll do 2-3 sets because it was so value-wise, it worked out so well for me. I charged them a lot. I charged them half the price or less than the Vivera, because the lab fees can sometimes be cost prohibitive. And so I would do them in-house because I thought it was less of an obstacle when I'm treatment planning and giving them costs. I could lower my fees because I could throw in-house made retainers. And the biggest problem was they just keep, as you said, it's night and day. It's stiffer, it's harder, it's more uncomfortable, and inevitably it always cracks because it's so stiff. And what happens is, and often it's because the way patients take it out, because they'll often like overflex it as they try and pick it out. But the problem is, like, then it's on you to keep replacing it. And when you draw the line, and get disgruntled patients. Whereas Viveras, I've seen a patient have a Vivera, one of their Viveras, for 7 years. I'm not saying anyone should wear it for 7 years. That's rank. But my point is, like, it's amazing and it's so much more comfortable. Everyone loves it. So I'm like you said, I've gone back. I've gone the other way now. I've gone back to Viveras. So now actually I've gone the other way where I've said to all my patients, I quote them for Vivera, I go, look, we can do it cheaper for you. And this was based off the back of a conversation I had with Andy Toy. And so I said, and I said to my patients, look, here's the cost, and it includes Vivera retainers. I said, if cost is an issue, I can make you cheaper retainers. And these are in-house made ones. They're nowhere near as good as Viveras. You know, this is like 20-year-old clapped out Fiat Punto versus Ferrari. And so I said to them, like, look, if you want to go cheap, you can go for it, and it'll give you something.
Yeah.
But I promise you, in 6 months to a year, you're going to come back and you're going to want to pay again, and pay double then for the proper ones for your for your Ferrari. And I find most people do go. They go like, if I'm going to go and do all of this, I might as well get the proper thing. Yeah. As you said, no one ever complains about Viveras. No one complains about Viveras. They're so comfortable. They're so good. That material is just next level.
You mentioned a little bit about technology and AI before. Do you think it'll replace the need for dentists and practitioners? We'll just get to a point where somebody turns up, gets their scan done. I don't know, maybe they bite into something, the machine scans their teeth, and then their aligners get posted to them the next week, and within a few months they got straighter teeth.
You can't do it. It's impossible. I know that people are like, what do you mean it's impossible? No, honestly, I'll pin my flags and masters, say like it's impossible, because someone has to assess the biology of the patient. That's the problem. You know, look, maybe if you're integrating CBCTs and a lot of stuff, but there is a lot of things like, it's not just like making a plan. You know, we don't just treat floating teeth. We're treating a person. So what's that person's wishes? Number one. What does their biology allow? What will they allow us to do? They may say, look, hey man, I don't want elastics. Hey, I don't want TADs. Hey, I don't want, attachments. But how do we then treat them according to their wishes? So we've got to think about what can we do according to their wishes? What can we do according to their biology? What will their biology allow us? And then most importantly, that the biggest thing in orthodontics at the moment is facially generated treatment planning. What's appropriate for their face? Now, if you've got someone with a massive class 2, and the problem is that they've got a 90-degree nasolabial angle. We haven't even done a set. We can see that they're class 2. The class 2, the lower jaw set further back, but their maxilla's in the right place. Are we going to retract their maxilla further back? We retract their teeth further back, and then give them a convex facial profile that look like a cartoon witch, like a big nose, big chin, convex facial profile? They look stupid. How do we respect biology? And look, I don't get me wrong. I think AI will have bits to play, but again, you're never going to have that patient's wishes, what their concerns are. You've got to there always has to be someone behind that. There may be someone. It may come to that point at some point in the future. There may be a clever way of doing that. But I think in reality, certainly in our practicing life, I don't think we'll get rid of a dentist.
Yeah.
There'll have to be a real human, making those, helping with the emotional aspects. Like there are bits that are like 1 and 1 makes 2. That's fine. But there are emotional aspects as well. There's art as well. There's a science to things. Like sometimes, when you got a problem in the mouth, sometimes you don't do things by the book. Sometimes you go like off-piste, and you'll come up with some novel way of trying to fix this tooth. Sometimes you can't put it in the perfect place. It's just impossible. Yeah. You make do, and you work out a clever way with an ortho restorative solution.
Yeah.
So I don't think we can be like the T2000 Terminators taking over the world scenario.
Well, we're definitely gonna have to do some part 2 in the future, because I'm gonna want to geek out on specific topics and really get in depth. At the moment, do you own a practice, or are you working as an associate?
Corporate associate.
Corporate associate.
I know. It's like the devil's work. How can you work for a corporate and be an associate there? But to be honest with you, like I think practice ownership for me would be like another level of. I think you got to know yourself and personality.
Mm.
I've never really. I thought I wanted to own a practice, and I realized I probably don't. It's a lot of work. I respect any practice owner because I fully understand like it's it's a job on a job.
Yeah.
And that's a hard thing to do. And I think I enjoy so I was like my job outside of my job would be the education bits
Yeah.
because I genuinely enjoy that and I love the advisory work.
Yeah.
I work with the line, I work with some other companies. I really enjoy that, and I enjoy that dentist to dentist interaction with the
Yeah.
teaching things. You can get aspects, I think, from practice ownership, but again, that whole running the staff, hiring and firing. And I think when I saw COVID happen and what every practice owner I knew was going through,
Yeah.
I just thought, I just don't want this. Like, this is just sounds like too much. But kudos to all the practice owners out there,
Yeah.
who have got the time and energy and patience to deal with it.
I'm thinking as well, because you're heavily involved with the liners, I'm trying to think of, there aren't that many disciplines within dentistry that allow you to travel as much as you do and go all over while still being able to, oversee your treatments back home.
Yeah. Oh, look, it's great because, yeah, as you said, like, you stick someone on the liners and then you can monitor them virtually and you can have trained therapists back home. If there's any issue, they deal with it. Or even your bond ups and your fits,
Yeah.
you can even work remotely where depending on where you practice in the world and what your rules and regulations are, your therapist could be doing your scans, photos, everything for you, and then you just sit there in another room somewhere else and like have a Zoom consult and chat with them about how you treat the problem. These are your options. What you're happy with, A, B, or C, extraction, non-extraction, whatever. And then go, cool, that's the one we're going for. Great. My therapist is going to bond you up in 2, 3, 4 weeks or whatever.
Yeah.
It's amazing. And then you get tracked them virtually and
Yeah.
you problem solve virtually, which is amazing. I always kind of joke that like scanning has made it possible to work remotely as a dentist.
Yeah.
Because during COVID, when we were all locked up, I was still making splints and retainers and God knows what for patients. Because they'd call the practice, go like, oh, my dog chewed my splint, or they chewed my retainers, or whatever, or I lost them, or I flushed them down the toilet. I don't know, whatever they did. I'd be like, cool. And I'd say, well, it's okay. I've got your scan. And we would print and make, or I'd call a lab, and one of my friends who owns a lab, he's a lab owner that I become friends with. He would go like, well, I'm going in 1 day a week over COVID to do any lab work. So just send it to me and I'll get it done this day every week. So he had making splints and retainers and bleaching trays or whatever.
Yeah.
It was great. And we sent it straight to the patient. And I never went into practice. I never saw them. And it was fantastic. And then even if a patient called up the practice and said, hey, I've broken a tooth, and even if they do that now, well, you can get the girls to go like, well, can you just ask them which tooth it was or where? Or I'll call them up. I'll go to myatero.com, have my Atero screen going. I'll go like, hey, so how's it going? Blah, 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 story. And then say, so you broke a tooth? They're like, yeah. You in pain? No. Okay, cool. Excellent. One less worry. Which tooth was it? Left or right? Oh, left. Upper or lower? Upper. How far from the back or from the front? Third from the back. Oh, that's that one with a massive amalgam. We spoke about doing a crown that last time. Do you remember that? Oh, yeah. That's the quote I gave you. Should we just book you in for that? We're not booking for a half an hour emergency. Then we go, oh, you need a crown, you need to come back again. We've got practice efficiency.
Yeah.
If you're away from home, you can line up all your big cases. So you've got production days and you're not sitting there heavy on checkup and cleans. And you can really balance your day beautifully.
Yeah.
Like it just means so many things. Like the amount of times I tell a patient, you grind your teeth, and every dentist goes through this. Hey, I think you grind your teeth, you're wearing them down. Oh, I don't grind my teeth. And you go, okay, well, look, these are signs, symptoms, keep an eye on it, blah, blah, blah. We can monitor it if you really want, because we can overlay our scans with time lapse. We can see up to 0.05 millimeters of wear or recession or whatever. Fantastic. But they call back up the next day and go, oh man, I'm grinding my teeth. Don't worry about it. We'll take a phone deposit or whatever, and we'll start making your splint. Yeah. Take their scan, whip it into Exocad, design it in 5 minutes, print it out on the 3D printer, go pick it up.
Yeah.
And then we just a quick 5-minute check between patients. Like, does it fit? Or I mean, because I'm a virtual articulator, it's so good. Often it's great. I very rarely have any fit issues.
Yeah.
We're good to go. And if you haven't got 3D printers, just send it to the lab, and the lab will give it back to you. They love 3D printed. Like I use Keystone Soft a lot, which is a great material. It's so comfortable and nice for my Brux's patients. But I think like we can work remotely. We can have all the remote workflows. If a patient decides, so whitening, I think is the biggest one. I remember always hearing. I go for weird tangents all the time.
You're okay.
But I remember when I was doing my VT program, there was a dentist who said, there was one of the VT trainers who said to us, like, whitening is like McDonald's moment in dentistry. And I said, what do you mean by that? And he goes, well, you should all be asking patients, would you like whitening with that? Just like McDonald's asked, do you want fries with that? And I was like, oh, that's interesting. And so when we talk about whitening with patients, because I scan every new patient, what will happen is when we talk about whitening, they'll be like, yeah, I want to whiten my teeth. And you say like, oh, well, should we do that for you? They'll go, oh, no, actually don't want to do it. Why? Oh, yeah, just, they're often put by the impressions. And then we say, well, we don't need to worry about impressions. We've scanned you. We're good to go. And then the joy in their eyes, and they're like, oh my God, I'd have to gag on those group impressions. Let's do it. And if it's a financial element, you go to the front desk, decide they want to go ahead or not, and then call back that day, same day, next day, or whatever.
Yeah.
And they're like, actually, yeah, I want to do that whitening. I really want to get on with it. Cool. And we just like print it. Or they'll call up in a few months. I've lost my retainers or whitening trays or whatever. Reprint, good to go.
Yeah. It's a no-brainer.
It's a no-brainer. Those remote workflows make your practice so profitable.
Yeah.
And make your book so profitable, because sometimes I won't have been in at work on a Monday or Friday, and then suddenly I get the practice reports for the week or the day, and I go, how do I make money on the day? I wasn't even in. And apparently, apparently one of my patients wanted a splint or retainers or whitening trays and things. So I billed a heap of cash on a day that I never even turned up for. And again, that's powerful. Because I just get going, just get it made. And then the convenience for the patient as well.
I want to ask, because actually before we started the call, you're telling me about, how Align's going to start moving into India and making it accessible to the general dentist. Give me some overview, bird's eye view comments on what you're seeing when it comes to just aligners in general and Invisalign. Yeah, just give me some overview stuff.
I think so. I mean, what we talked about was the fact that a massive market's opening up in our region in Asia Pacific in terms of India. So I think India, general dentists weren't really able to do orthodontics, and now the regulations have changed, allowing them to practice and do some orthodontics in practice. So of course, now that's a massive market that's opening up. There'll be a lot of very, very eager dentists keen to get on with, obviously, like every market, because they're obviously looking at the rest of the world, and they're looking at Invisalign everywhere on like social media. Like we've got a global economy, a global market these days. You can see what's going on in other countries. Often here in Australia, I'm looking at what's going on. I'm always looking at what's going on in Western Europe and North America and South America. Like some of the stuff the South American guys are doing are amazing. Like you see what these guys do, their skills and what they're doing, and so you look at the new products coming to market, how they're doing it. And so I think India's probably looking at it going like they're about to explode. I think because I think now that they've opened up to that market, it's going to be massive. So I think a lot of people will be looking at that market because it's.
Would you necessarily go in yourself to help with the training? How would that work?
I suspect there will be dentists from our region who will be asked to go over. I'm not sure what that looks like formally, but I know that there is so I know one of the trainers from Australia, New Zealand. She goes over to parts of Southeast Asia to help them. I think she does Vietnam and somewhere else, one of the other markets, which again is a young market because they got Go recently. But she does those ones online. But there's a lot of online training and stuff for that. I think that there's going to be aspects of that. I think there'll be other general dentists who, as long as their language skills are good, they'll be asked to go over to that market and help train them. So I think that's going to be something that's going to be big. But I think as a broad thing, I think the whole ortho restorative thing is massive. I think 3D printing is massive. How that integrates with the line is interesting. I don't know. I mean, I think there was a big. I don't know if you're aware, but I think there was a big press release that came out that Align had bought into a 3D printing company. I bought also 3D printing company. That was only about a week or so ago. I don't know what that's about personally, or what's going on with that. But like, I think that's very interesting to see what they're going to do with that. I think for me, the big thing is going to be Exocad integration. So Align bought Exocad about 2 years ago, but it hasn't fully integrated into the Align ecosystem. But I think what we're going to see from my conversations within Align and things is that there's going to be greater integration of Exocad within, or that technology within the Align ecosystem, and especially Itero, because Itero's always had this thing about it's not just an Invisalign scanner, it's a restorative scanner, it's a communication tool in every tool.
Yeah.
And Itero's roots were in restorative. The original Itero, which was a Cadent, was a restorative scanner. But the integration of Exocad into it and using those tools, that software, I think that's going to be epic. I think the way I honestly believe that we're not going to be doing packing composite in a few years' time. We'll be 3D printing our resin restorations. We'll do our prep, we'll scan it, we'll 3D print it on like a Sprint Ray Pro 55S in like under 10 minutes.
Yeah.
And then we'll cement it in. I think for anyone who doesn't know that workflow or hasn't seen it, look at the MOD Institute on Instagram, and Dr. Wally Renee and Dr. Michael DeFee, and see what they're doing. So Wally Renee is a renowned like general dentist who's really big on 3D printing, and Michael DeFee is a prosthodontist who hasn't done any composite in 3 years because he was so adamant he wasn't going to use composite, a direct composite. He did an endo and he filled the access with a 3D printed restoration. He wanted to make a point, and I just love that. That is just incredible. I mean, that says a lot already, doesn't it? But I think that's really powerful when you look at it. No prep veneers, like how we place composite, we can do that in 3D printing. We can do our implant restorations, modern ceramic resin combinations. I mean, America's reflecting that in its insurance, in the way that your insurance claims are done. Yeah. So now they recognize if you use a resin that's 50% ceramic particles or more, you can claim it as a ceramic restoration under their insurance policies and their claim system. So they're already regulating, the regulatory bodies are already allowing for 3D printing. That shows you where the market's going. Yeah. So 3D printing, all that stuff, I think ortho restorative, Exocad, Itero, I mean, I think that's going to be massive. That's where we're going to see a lot of change, I think, coming in the next year or so. I think what we're waiting for is like the resin approval. So already in the States, they've got more resins that have been FDA approved. I think we're waiting on CE approval in Europe, and then a TGA in Australia, but it's coming 100%. I mean, I can't believe what the rest of the world, we've been so slow to tag on to even like digital dentures. Like America's been doing it for a while now. And we've been so slow to tag on. But, patient comes in a broken tooth and you go scan, bang, print out a denture, same day they've got a denture, they've got a tooth, they've got their dignity. Yeah. They go to a ball or a wedding or whatever, then yes, bring them back and then do the implant or the full restoration when you've got time. But to be able to give them their dignity on the day is a powerful tool, give them their bite, their smile. And we have the power to do that in practice for not very much. I mean, if you're getting a print like that, I mean, Australian dollars wise, I think it's about like something like, if you're getting a platform so you can 3D print it out in 10 minutes, like restorations and crowns and inlays and onlays, you're looking at spending around, I think, around the $26,000 mark-ish, somewhere between 20 to 30,000 Australian dollars, which is what, 10 to 15,000 pounds, maybe, I think, roughly. But if you want to buy, you want to go and buy a CEREC, it's like $250,000 Australian dollars, or like maybe 125,000 pounds or whatever it is in the UK. I don't know. I don't have one. But you're going to do one unit at a time, and you've got to do it. You can't do dentures. You can't do splints. You can't do implant guides. You can't do anything else. your ROI is hopeless. But on a printer, coupled with your iTero and your online ecosystem, it's your ROI is like you make your money like that.
Yeah.
You'll go back and you'll be able to give patients everything they want quickly and conveniently. Like that's such a powerful tool.
Yeah, no, it's exciting all that's still to come because I think because we spend a lot of time in the Invisalign ecosystem, you think that a lot of people are aware
Yeah,
about what's possible and what's happening, but it's probably a small amount, a small percentage of people that are actually aware of where we are technology-wise and what's actually happening in practice who are utilizing this technology. I would love to have you for much longer, but we're gonna have to keep the rest for a part 2 and a part 3. Where can people find you and just get to connect with you?
So probably Instagram's probably easiest. So I just go by the moniker at Chats the Dentist. So CHATS the Dentist. That's probably the easiest way to see like what I'm up to, where I am. Otherwise, yeah, I think that's the easiest way. I'm sorry, that's how we've been staying in touch anyway as well.
Yes.
What I've got to improve, but I've got to be more like you though. I think I remarked as well after we met. Like I need to post content more. I couldn't believe how many posts you put up, and the way you got the way. I was just actually having dinner with my lunch, sorry, with my brother-in-law, and our families, and I was showing him your Instagram. He's like, "Oh wow, like you are like producing the content and everything's like." I've got to do more of that. I find it really hard all the time. I'm always amazed by anyone who produces content regularly, and especially good quality content. It's really hard thing to do.
Oh no, thank you for that. But it's mainly the team. I couldn't do it by myself. The team's gotten good at really chopping everything up. Even this, they'll be chopping it up into YouTube videos, shorts, TikTok, Instagram clips. So it's the team that makes it possible. But no, thank you very much. And guys, we will see you on the next episode.